Good morning. My name is Lindsay Cartier, and I'm here to speak with you about the nursing shortage. Research suggests that the current nursing shortage has no foreseeable end in sight because of the deficit between nursing school graduates and available positions and the increasing demands placed on the bedside nurse. The nursing shortage often does not mean a great deal to many people. Let's imagine for a moment that you yourself are a patient at a local hospital. You awake, your heart beginning to race, sweat beating at your brow. You press the call light, desperately scanning the room for your nurse. A minute or so passes, but for you it's been an eternity. Your nurse finally arrives to care for you. Why is this happening at an increasing rate nationwide? Because nurses are often caring for 6 or 7 patients all at the same time. The United States is in a severe nursing shortage with no relief in sight due to many factors combining the problem, resulting in decreased patient care and increased nurse burnout. The Bureau of Labor and Statistics has called for 526,800 new nurses will be needed by 2022, an increase of 19.4% from 2012 to keep up with patient growth and to recover from those leaving the nursing field. Nursing schools are unable to keep up with the demand for nurses as they themselves are dealing with the nursing shortage. Combine that factor with the number of nurses leaving the field and the deficit is truly staggering. In 2013, the AACN reported that nursing schools in the United States turned away 79,659 qualified applicants from their bachelor and graduate degree programs. The insufficient number of faculty, clinical sites, clinical preceptors, classroom space, and budget constraints were the top reasons, with 2/3 of all nursing schools reporting faculty shortages as the #1 reason for less admissions. Unfortunately, universities and colleges are unable to compete with hospitals and other healthcare organizations with employment incentives and benefits to lure nurses to become nursing instructors. Nursing instructors often work long hours both in the classroom and at the clinical site. The statistics are truly staggering for the number of nurses that will be needed to be graduated. In 2008, the College on Physician Supply and Nurse Supply called for 30,000 additional nurses to be graduated annually. That's an increase of 30% to keep up with the demands of nurses. Combine that with vacancies for registered nurses amounting to 135% annually. This results in a job vacancy rate of 8.1% in the United States. The figure 8.1 doesn't really sound like a lot, but it equates to around 260,000 nurses we will be short by 2025. Increasing demands placed on the bedside nurse have also increased the nursing shortage. Nurses often report feelings of dissatisfaction and increased workplace stress. Let's go back to the hospital scenario for a moment. Now you are the nurse. You have 7 patients. How do you differentiate who gets your time first? In 2015, an issue of Nursing Economics, Dr. Peter Bearhouse and his colleagues reported that 75% of all registered nurses believe that the nursing shortage results in a decrease in the quality of their work life, their quality of their patient care, and the amount of time they spend with each patient. The decreased time that nurses spend with patients increases the risk the patient will have a complication or a readmission to the hospital. A recent study of all heart failure patients suggests that for each additional patient a nurse has in his or her workload will result in a 7% likelihood for readmission for heart failure for those patients. Complications specifically associated with nurse-to-patient ratio are cardiac and respiratory complications. This will increase the demand for intensive care units and increases the length of stay, thus increasing the need for nurses. Dr. Linda Aiken reported to the American Journal of Medicine that failure to retain nurses contributes to avoidable patient death. The combining factors of increased workplace demands and the deficit between the number of nurses graduating annually and the number of positions available has created an insurmountable shortage. The shortage has continued to grow with no foreseeable end in sight, and we must promote the field of nursing. Nursing provides many opportunities both in the hospital and outside of the hospital in colleges and universities. Employers have started to increase employee satisfaction by doing studies and mandating nurse-to-patient ratios, but we must continue to combat this fight. Thank you for your time and have a great afternoon.